So it's my great pleasure now to invite onto the stage Professor Regina Merrig-Stern. I'm sure I haven't said that well, but Professor Regina Merrig-Stern is a chair of prosthodontics at the University of Bern, and she's been a professor there for over 15 years. She's trained students for over 30 years, and she has an extensive biography, which I'm sure you've all had a chance to look at. I want to share with you three things about Professor Stern that I learnt last night, which aren't in your biography, and I thought were interesting to share. It's very befitting that her first lecture in English was here in Oxford nearly 20 years ago. So it's welcome back to Oxford 20 years on. She first met our President Ken Hemmings 20 years ago in Toronto when she was a visiting senior lecturer, guest professor with Professor Zarb and his team. Ken was obviously in Toronto at the time. You can see that she's published extensively, and in her spare time she manages to be an accomplished violinist. So welcome, without further ado, welcome to the stage to present to us management of the failing dentition in the elderly patient.
Sorry. Good morning all together, and thank you very much for your kind introduction. I'm very pleased to be here, and thank you for the invitation. It was a great pleasure to come back here, and I hope you can understand my English. It's a little bit Swiss-German English. It's not Canadian, it's not American, it's not English, it's Swiss English. So I thought this is a very nice congress, very nice meeting, interesting topic. But the more I worked on this topic, the more I saw that my lecture is quite difficult to come to a good conclusion, to a good end, to good suggestion, and we will see why. So this is our dental school. If the weather is fine, we have a good view on the Swiss Alps, and I bring my best regards from Switzerland. You see, the dental school is quite small. The city of Bern is small. It's not comparable with Oxford and the students you have here, I guess. So what about teeth? Teeth are an important thing in the mouth, in the body of the patient. And we heard before, it has a great impact on quality of life. And you see, it's the hardest tissue in the body. And for animals, for instance, here, it's a weapon. It's important to survive. It may be a cultural issue, and it may be medicine, but it may be also commercialized. It may be cosmetics. This is an advertisement of a young dentist in Bern for his office. And it could also be an advertisement for a hairdresser, or maybe for Armani jeans or something like this. So you see, dentistry has a very, very broad background and has a great impact on the social, cultural, and economic status of the population we are talking about. And that's why I think it's not so easy to talk about the failing dentition. For some people, this may be a big, big problem. For us, it's not so much. Okay, the choice of our treatment, and I'm talking about failing dentition as a prosthodontist, and all my patients have already lost some or even many teeth, so I don't see mostly patients with a full complement of teeth. We should use the best scientific evidence for our treatment plan, for our diagnosis. This is very important, but then we have the part of the patient, all his expectations, his wishes, and then we have the risk of the patient. We have to calculate in the long term. We do the single tooth prognosis. We have to look at financial aspects, at the healthcare system. The more I discuss with dentists from different countries, the more I see that treatment plans are influenced by the healthcare system of